everyone. This is Dr. Shama Tazara, and today our topic of discussion will be very interesting and very fascinating for pathologists to see under the microscope. So, this is infections of the central nervous system. So, it's always cool when we see organisms under the microscope, and I personally get very fascinated and I enjoy that. Not good for patients, but like we being pathologists enjoy it. So, let's dive in. That's our topic today. So this was basically my presentation at my observership rotation at University of Washington. These are gonna be a series of lectures on different infections of central nervous system. I'll break them one by one, and each video would consist of a single infection. And today our focus will be, this is how we would continue. Focus would be rabies today, but first an overview. Overview here is that what we would actually discuss here. First of all, we'll talk about the infection name, obviously. Then I'll give a brief scenario of how that patient presented, then the characteristic histological findings by which we can actually diagnose the case on H&E, the characteristic IHC findings which are relative to the diagnosis, and then at the end I'll briefly discuss how the infection occurs, its pathogenesis, and a little bit on its clinical presentations, and if there are any complications I would actually discuss them at the end of the meeting. And after that, just a glimpse of any of my nice memory at University of Washington or any cool pics of Seattle. So this is how we'll go through all the series. So let's get started. So today, in this video, our topic of discussion would be focused on rabies. So, what is rabies? Just give me a minute, I'll change the pointer. Okay, so this is rabies. How this patient presented, it was a middle-aged man with cognitive impairment and seizures. So on H&E, what we saw were the Negri bodies. So before diving in what Negri bodies are, I'll tell you that what we're seeing on this microscope. Here, this is basically a slide of the cerebellum, and this is the molecular layer of the cerebellum. This is the granular layer of the cerebellum, and here the area pointing are basically the Purkinje cells, which are on border of both the areas, both the zones. Okay. Now, what are basically Negri bodies? I just zoomed on this thing out. So this, now what are they? They are basically sharply delineated, either round or oval shaped. Eosinophilic means pink colored inclusions within the cytoplasm of the neurons. So here we are focusing on this neuron you see on your screen. This is its nucleus, slightly blurred, but you would see it, and this is its cytoplasm. So here are those Negri bodies which are characteristic for diagnosing rabies. This is the first finding. Secondly, we do see Lyssa bodies. So what are Lyssa bodies? They are again, the ultrastructurally they are same as Negri bodies, but they are more pleomorphic and they are less well defined. So this is the image I've taken out from the cerebellum. Again, these are the molecular layer. This is the granular layer of the cerebellum. Here we do see the Purkinje cells, and zoomed out this Purkinje cell here, we see that these are the pink eosinophilic more pleomorphic and more variable in shape. They are less well defined as compared to the one we saw before, which are the Negri bodies. And thirdly, again, the eosinophilic means pink colored inclusions where within the cytoplasm of the neurons, and this is this is basically the Purkinje cells of the cerebellum. So these are the second finding, which is Lyssa bodies. Third, we do see Babes nodules. Now, what are Babes nodules? These are what we see on your screen. I'm highlighting with the pointer. So what are they? These are basically clusters of microglia that are remained after neuronal destruction, which occurs in rabies. Okay, so what are microglia? Of course, these are the phagocytes which come in and eat all the dead neurons, and this is how the destruction process occurs within the central nervous system. So microglia, and these are the Babes nodules, the third characteristic finding of rabies. What other findings we can see? They are widespread polioencephalomyelitis, leptomeningeal and perivascular lymphocytic infiltrate. We call this perivascular cuffing. We do see here in this image, like this is a blood vessel. I'm highlighting with my arrow, and these all are the lymphocytes which are perivascular, means around the blood vessels. And why we called it cuffing is that they are basically like cuffing a blood vessel like this. They're just holding it tight around it. So this appearance is called a perivascular cuffing, and it is seen within the rabies. And neuronophagia, of course, that neurons would be dead caused by virus infecting them, and this actually leads to the Babes nodule we discussed before. So, IHC positivity, which IHC we use to diagnose the rabies, or I would more specifically say to confirm that it's rabies. So these are basically rabies virus antigens. How they are detected? By using specific anti-rabies monoclonal or polyclonal antibodies. And this red stain you see on the screen is basically the presence of rabies virus antigen. Which stain is used in this method? That's the streptobidine-boutin complex staining method, how we diagnose it. And this IHC is actually more sensitive and specific as compared to the H&E findings we saw before. So worth mentioning and worth remembering, it's important. Little bit on the rabies pathogenesis. So, how it is transmitted? We all know rabies is transmitted by bite of a rabid animal. So, first of all, there's a person, any animal who is a rodent specifically is infected by rabid. It comes, it bites the person. So, how it is transmitted? Bite of a rabid animal. After it, now, but it would bite, of course, the muscle in the area where it's bite. So, it replicates within the skeletal muscle at the site of the inoculation, the virus. Now, after it replicates, it then is taken up by the axons of that area, the nerve which supplies there, the axons, which are the processes of the cell bodies of the neurons. They then transport it centripetally. Now, centripetally is towards the body, towards the center. Now, it would then transport the virus towards the central nervous system, okay, and there virus replicates within the central nervous system through the spinal cord to the brain stem up to the cerebrum and then the cerebellum, and this is how it is transmitted and then replicates. Now, what are the most common sites affected? That's the Purkinje cells of the cerebellum, we saw in detail in the slide I showed you before. Secondly, our prone areas are the hippocampal pyramidal cells, and thirdly are the brainstem nuclei. These are the most common affected sites, though other parts of the central nervous system can also be affected. And then other method is that it spreads centrifugally. Now, what centrifugally is that it moves away from the center, getting towards the body. So how it does it? That virus move within the nerve fibers towards the peripheral tissues. First, it was moving towards the central nervous system. Now it's moving to the peripheral tissues, including the salivary glands and the lacrimal glands, from which then the virus is shed within the saliva and the tears. And that's why rabies patients, if you've studied it before, you will know that major findings are that excessive salivation, hypersalivation, or excessive lacrimation, which is excessive tears going on. So these are the findings in rabies patients. Moving on to the clinical features. Now, how it is transmitted, that would be the pathogenesis, we understood that. Now, how would the patient present with rabies? So the incubation period of the virus is from 10 days to 1 year, pretty long. In fact, pretty variable, I would say. The prodrome symptoms that start within a 2 to 10 day period, and it's like a flu-like symptoms, like 2 to 10 day period from the inoculation. Okay, so how it would present as flu-like symptoms like headache, fever, malaise, sometimes pain, and paresthesias would occur at the site of the bite wherever the patient was bitten. Then after the prodrome period, it can progress to the acute neurological disease that can last from like 2 to 7 days, and it has two major forms by which it would present. Either it can be a furious rabies or it can be a dumb rabies. Now, what furious rabies means is that highly aggressive. This is a name of the presentation, how patient can be. Why furious? Imagine a patient who is furious, like agitated, he can't sleep, in insomnia, is aggressive behavior, hallucinating, hydrophobia, brainstem dysfunction, which can present in various findings like dysphagia, dysarthria, nystagmus, even cardiorespiratory disturbances. And dumb rabies is another presentation, and these two forms can even overlap in a patient. How would a dumb rabies present? Like a dumb person who's just lying down doing nothing. So that means either imagine that how it would be like paralysis of either one or more limbs, and it can even mimic the GBS, which is an ascending paralysis, and even sensory loss can occur or incontinence can occur. So this is the overall presentation, how it would present. Moving on to the complications. Now, the terminal stage. First, we talk the incubation period, then the prodromal phase. After the prodromal phase, it progressed to the acute neurological disease, and after the acute neurological disease, if it's not treated and it progress, it can lead to the terminal stage that can progress to stupor, coma, and even death of the patient. And it do has some complications like inappropriate ADH secretion, diabetes insipidus, cardiac failure, and even respiratory failure can occur because of rabies. So this is the whole overview of how rabies infection occur, particularly focusing on I'm from pathology, so of course more focused on pathology, but just an overview of the general disease. Talking in summary, rabies, points to remember. It's transmitted from bite of a rabid animal, how it replicates either towards the central nervous system or away to the peripheral tissues, representing as common symptoms. On H&E, we see Negri bodies within the cerebellum Purkinje cells, or Lyssa bodies. Babes nodules can be seen. And then some other findings like perivascular cuffing and leptomeningeal involvement and neuronophagia, and IHC points, red stain, which highlights it, and it's more sensitive and specific as compared to H&E. So this is all of our discussion today. Thank you so much, everyone, for your attention and for your patience. I want to really especially say thanks to my attending during the presentation, Dr. Daniel A. Child, who gave me the opportunity, and also my neuropath fellows and my very good friends, so Dr. Alex, Dr. Joyce, and Dr. Lucy. They really helped me throughout the work, so thank you, everyone. So this was just a nice memory of my UBOS journey. So this was my desk, and this is Beta. This is the cute fish. She eats a lot. So that was like the official pet of UBOS Neuropath department. So that was fun, and that's all for today. Look forward to the next video. There will be another infection, and I hope you guys liked the video, and if you did, just give me your feedback in the comment section, share it with your friends, help others to learn if you find it helpful, and the seniors watching, do correct me out if I said something wrong, and thank you. Bye bye. See you in the next video.